Hi everyone, my name is Nicole Fatka and I am currently working as a secondary school athletic trainer. I am in the Master of Health Science program with a specialization in athletic training. My presentation is about the effects of early physical activity compared to complete physical rest and concussion management. Throughout this presentation, I will address my practice problem, PICO question, literature search, evidence, Rogers diffusion of innovation model, data-based evidence, dissemination, and my conclusion. Concussions and the treatment and recovery of them have been a very popular topic the last couple of years. An estimated 1.6 to 3.8 million concussions occur in sport and recreational activities annually. When discussing the practice problem, I feel it is important to define what a concussion actually is. A sport-related concussion is considered a mild traumatic brain injury resulting from biomechanical forces that are directly or indirectly transferred to the head, causing the brain to shift or move inside of the skull. Being an athletic trainer, I am no stranger to the care and management of concussions. We are fortunate enough to be with the athlete from beginning to end, and in the state of Illinois, we have the luxury of clearing the athlete for participation. With that being said, athletic trainers perform a concussion evaluation, and based off of the graded symptom checklist and their scores from the SCAT, we are able to decide whether an athlete has a concussion. The graded symptom checklist is a list of 27 common symptoms that may be experienced after a sport-related concussion. Once diagnosed, the athlete will be removed from school and physical activity until they have been symptom-free for 24 hours without the use of medications like Tylenol. Once they have been symptom-free for 24 hours, the athlete can return to school and begin their return to learn, return to play protocols. Time lost due to a concussion is at least 5 days following symptom resolution when following best practices for full return to contact sports. Most concussions resolve within 2 to 4 weeks, but approximately 10 to 33% of individuals have persistent symptoms for months after the initial injury. Emerging literature has indicated that prolonged periods of physical rest may be detrimental to sport-related concussion symptom recovery. Using light aerobic activity may decrease the symptoms quicker and may get our athletes back to play in school quicker. So my PICO question is, in adolescent athletes ages 5 to 18 years old, what is the effect of early light aerobic activity on sport-related concussion symptoms compared with complete physical rest? In the beginning stages of searching this topic, I started very broad and kept all my options open because I wasn't sure how much research was available on this topic. I searched terms like physical activity and concussion. There were around tens of thousands of articles to go through, so I limited my research to the university's library and used search terms like early physical activity concussion. I still had around 2,000 articles to review, so I continued to narrow down my search by date of publication, which had to be from 2010 to 2020, and only see academic journals and reviews. I also refined my articles to English. I refined the subject to include brain concussion, sports injuries, brain injuries, sports medicine, concussion, athletic injuries, medical care, quality management, physical training and conditioning, physical activity, brain diagnosis, and traumatic brain injury. Finally, to help narrow down, I chose what publishers I wanted to review, which was the Public Library of Science, Allen Press, American Public Health Association, BMJ Publishing Group, Health Day, Gale, Cengage Learning, Human Kinetic Publishers, American Medical Association, Pediatrics for Parents, Allen Press Publishing Services, American Chiropractic Association, Journal of Sports Science and Medicine, American Academy of Pediatrics, Foundation for Rehabilitation Information, National Athletic Trainers Association, National Rehabilitation Association, and Open Journal of Occupational Therapy. After adding the inclusion and exclusion criteria, I was left with 97 articles to review. The only database or search engine that I had used was the University of St. Augustine's online library. 5 of the 6 articles agreed that exercise should be introduced within the first 7 to 10 days post-concussion. One of the articles introduced exercise as early as 72 hours post-concussion. When it came to the use of a concussion symptom measurement, only 4 of the 6 articles had used one. Among the 4 articles, the post-concussive symptom inventory was the most popular, with 3 articles using it. The post-concussive symptom inventory is a self-report inventory. One of the articles used the IMPACT test. IMPACT stands for Immediate Post-Concussive Assessment and Cognitive Testing. It is a widely used neuropsychological testing battery designed for assessing and managing the neurocognitive aspects of sport-related concussion, and it is also computerized. Along with the grading symptoms of the participants, 2 articles had also used the Buffalo Treadmill Concussion Test. This standardized test was used to determine the level of activity the athlete was ready to engage in, and also to test the athlete's exercise tolerance. All 6 of the articles agree that implementing aerobic activity early in athletes with acute concussion reduces their symptoms quicker. For my change process, I chose Rogers' diffusion of innovation model. I chose this model because there is more research that needs to be done on my topic, but this model seemed to have all the steps necessary to still promote the change. This model is all about sharing new ideas and innovations, which is exactly what my PICO question is doing. It will take time to gather enough research, but in the meantime, the change process can still start using this model. Even though more research is need to be done, there is evidence out there for the use of early light aerobic activity. Using that knowledge, I can start my persuasion with my school administration, coaches, athletes, and athletes' parents. As a group, we can make the decision to implement this change. All participants will need to be evaluated by a certified athletic trainer to determine if they have a sports-related concussion. The evaluation tool used will be a SCAT-5 and a symptom checklist. The type of data variables that will be collected in measuring my outcome will be scores from the symptom checklist, which shows the athlete's symptom severity, the age of the athlete between 5 and 18 years old. The athlete must have sustained a sports-related concussion and be diagnosed, the length of time of symptom recovery, and the length of time until full return to play. Data will be collected by a certified athletic trainer using their professional judgment for observation. The athlete will meet with the athletic trainer and fill out their symptom checklist daily, and those symptom checklists will be kept in the athlete's file. A chi-square test will be used because I want to look at the length of recovery and compare to my intervention to the current standard of care, and I also want to have a placebo group. If I choose not to have a placebo group, then I will use a Mann-Whitney U test. I will determine my results by comparing the athlete's symptom checklist scores and Buffalo Concussion Treadmill test. This will show if the athlete is improving. I will also refer to the dates on the documentation, and that will show if there was an increase or decrease and the amount of time that it took for their symptoms. So in my presentations, I would present that the evidence I have found does in fact show that early physical activity does decrease symptom duration in adolescent athletes with a sport-related concussion. When it comes to coaches, athletes, parents, school administration, pretty much anybody not an athletic trainer or in the medical field, I would use very common terminology and easy to read and follow presentations. When it comes to athletic trainers and other medical professionals, I will use more evidence and more proper terminology in my presentation. I will also give statistics. I would invite coaches, school administration, athletes, and their parents to a school board meeting where I would share all of my results with them. For the athletic trainers, I would present at the NATA National Convention in GLADA, which is the Great Lakes Athletic Trainers Association, I will also share my results in the Journal of Athletic Training and Athletic Training Education Journal. After reviewing the literature, my practice recommendation is that there is a clear consensus that early aerobic activity does in fact reduce post-concussive symptoms compared to the standard physical rest. Implementing controlled early aerobic activity has been shown to not only reduce post-concussive symptoms, but it also reduces the time the athlete is absent from sport and school. For this to take place over the standard rest, there needs to be a consistent way of tracking the athlete's symptoms when it's best to initiate the exercise. There needs to be a standardized test that would be used to gauge the appropriate level that the athlete can exercise at, and a guideline if the athlete is regressing. A good standard test that I will be using is the Buffalo Concussion Treadmill Test. So in summary, we went over my problem and PICO question, the evidence that supports it, the change model, data-based evaluation, my dissemination, and my conclusion. And then these are my references. Let me know if you have any questions, and thank you.